Hi, my name is Abby Dumes. My pronouns are she, her, hers.
And I'm Fiona Lowenstein. My pronouns are they, them. And I am a white person with a black t-shirt and blonde hair, combed back, sitting in front of a glass door that is showing a little bit of the view here in the central coast of California this morning. And I'm sitting on a white armchair.
Wonderful. Fiona, thank you so much for being here and being willing to share your story with the Global Feminisms Project. We really appreciate it. And we're going to briefly introduce you, and then I'll move on to the interview questions. So Fiona Lowenstein is an independent journalist, TV producer, and speaker whose work focuses on health justice, wellness culture, gender, sexuality, and the media. Fiona graduated from Yale University in 2016, and while there was a member of Yale Radio, Yale's, quote, oldest only feminist comedy troupe, and was editor-in-chief of Yale's feminist publication, Broad Recognition. In 2018, Fiona founded Body Politic, a queer wellness collective that has transformed into a grassroots, patient-led health justice organization. And in 2020, they co-founded the Body Politic COVID-19 support group, which now serves over 11,000 patients across the world. So I thought we'd start a little bit with some background about your life and where your story begins. That is, how would you describe the journey that brought you to where you are today?
Yeah, so it's kind of funny because I think if you had told high school Fiona that they would be very involved in public health in some regard, I would have been like, that's a curveball because I didn't myself as a science person. And obviously some of that may have been the way that science is taught and who's kind of socialized to identify with certain STEM subjects. But looking back on it, there were a lot of kind of early experiences in my life that I think led to me having somewhat of a, I guess, just law exists in our country. And so, sorry, can you still hear me? I know it just...
There was just a little bit of a pause, so maybe...
Okay, yeah. Yeah, so growing up, there were a few kind of formative experiences and relationships that I think made me actually kind of poised me to speak about public and have an understanding of healthcare in this country. So the first was that I was really lucky as a kid to grow up with Barbara Seaman as a mentor. She was a leader in the feminist health movement and her kids went to high school with my dad, was a family friend, really kind of took me under her wing. So she was a huge influence in my feminist journey as well, because when I was 8, 9, 10, 11, up through middle school, she was bringing me to documentary screenings and introducing me to feminists of her generation, but also younger feminists. And one of the things that she did so well was really trying to build a very wide network of people. So, she was in touch with feminists that at that point were kind of in their 20s and 30s and connecting me with those people. And of course, wow, she had this very radical stance on health justice. And she talked a lot about issues with the birth control pill, issues with hormone therapies for, people going through menopause. That was kind of what she was digging into at the point that she passed away when I was around 14 or 15. So I think that is something that really shaped my perspective on both feminism and health justice. And I just, I wish I could have a conversation with her today, because I feel like she's been so influential in my work today. And then in addition to that, I grew up with parents who were self-employed. My parents were artists. They did not have employer-based health insurance. Mm-hmm. I have one parent with a pre-existing condition with an autoimmune disease. And so I just grew up seeing kind of how a fractured healthcare system and can impact, a family in that situation. And also just grew up seeing how limited my parents' kind of ability to get the care they needed for both themselves and for me would become, just simply because, they were not independently wealthy. They didn't have kind of a financial safety net to fall back on necessarily. And of course, they were constantly like trying to switch plans and that sort of thing. So
right.
Healthcare and health insurance was just a huge topic of discussion when I was growing up, ever since I was very little. I remember my parents being on the phone and arguing about things and, sharing some of that with me. So I think both of those things had some level of impact on what I'm doing today just during the pandemic, but more kind of on I grew up in New York City. I grew up in a family with a lot of artists in it, with a lot of people who had kind of done something really different with their lives from what those around them were doing, or, their parents had done. And so I think there was very much, I was raised to believe that, you have to some extent an obligation to the public collective and to kind of, the people around you and the world around you, and to try and make a difference and speak up if there is injustice, in front of you. But also this idea that like the best thing you can do is pursue your passion and pursue what you're good at. And you shouldn't try and, fit a square peg in a round hole or whatever they say. So I think that has also, I've had a somewhat untraditional career, and that is a tradition in my family. Yeah,
it's a family convention to be unconventional.
Exactly.
That's really illuminating. I saw that when you were at Yale, you majored in history. I'm curious how that choice reflects some of what you just told us about.
Yeah, so I've always been a huge history nerd. When I was a little kid, I used to just, at the dinner table, kind of like ask my parents, that classic, like annoying little kid thing of, why is this way? And then they would say, well, because this happened. And I would go, but why did that happen? And it would just be like an ongoing thing.
Why?
And so, yeah. And so my parents joke that like, I was very little and I was asking for like books on World War I. I think there's actually like a famous story of my grandfather coming over to babysit for me and tucking me in and having to read this like book on like, chemical weapons and being like, are you sure you want to hear about this before bed? I think I just, I lived in New York City, so I was exposed to a lot of stuff, but I didn't travel very much as a kid. My parents didn't kind of, have that kind of money or lifestyle. And I was really curious about other parts of the world. And also spent a lot of time with my paternal grandfather and my maternal grandmother, who both lived in New York City and were kind of like my primary caretakers outside of my parents. And loved spending time with older people, honestly, as a kid. And so I think I was very eager to just understand some of these stories from within my own family, kind of situated into a broader historical context. And so I think I mentioned like that, doing things the non-traditional way has a long history in my family. And the other day I realized that all four of my great grandparents all married outside of their either race, religion, or ethnicity. And so I think like hearing, those were big stories that were told a lot, as a kid, kind of these love stories of people, crossing boundaries to be with her. And so there was a lot of wanting to just understand, why was that way at that time?
Right.
That sort of thing. But I also just like history because it's straightforward. Like I thought I wanted to maybe major in poli-sci, and then like, why are we making up all these words and like, systems to describe the world? Like I kind of like stories and I like storytelling, and history is just like one long, amazing story.
Yeah,
while I was at Yale, I also got very into kind of, I studied with someone named Bill Rankin, who's a professor there, who is an amazing scholar on the history of science, and he focuses a lot on cartography and mapping. So I, toward the end of my time at Yale, got very interested in kind of this idea of histories and also tools of science, not necessarily being objective, but being in some great tools of colonization or patriarchy or whatever it is. And that was like very mind altering for me at the time. And so that was a real focus as well. But within the history major, I studied a lot of took a lot of classes on social justice movements. And I also focused quite a bit at the beginning on the Middle East and Turkey specifically, because I had kind of been obsessed with Turkey as this, just because of, the sheer number of important historical events that have been beginning since the beginning of time. I studied Turkish and traveled to Turkey a little bit when I was earlier in my career at Yale.
Oh, wow. So interesting. So I guess thinking about how that connects to the work that you're doing today, I'm curious how you were drawn to that work between undergrad and now, and maybe in that brief time, a lot has changed in the world, how that's changed for you personally, and how that has evolved, and how the work has informed you personally, and how your personal experiences has informed the work.
Yeah, I mean, I graduated from college in 2016, so the world changed quite a bit that very year. And obviously, you know, not to say that election changed things overnight. There was that a lot of that had been brewing for a long time, but I was working after I graduated college. I worked in nonfiction publishing as an editorial assistant. My background, you know, I was trying to kind of pursue journalism, and so I was working on nonfiction titles. And I just remember, you know, after Trump won the election, this feeling of just not knowing what to do, because I was very used to, when I had been in college, when there was a crisis, whether it was, you know, a you know, world crisis or a college campus crisis, having my communities that I would tap into and kind of mobilize with. And, you know, whether it was when I was a senior at Yale, actually, there were a number of kind of big political things that happened on Yale's campus. There were a lot of protests for racial justice in the fall, and then in the spring that made national news. And then in the spring, there was an issue with the captain of the basketball team being, I think, suspended or expelled for sexual assault while the basketball team was like entering March Madness, and it became this huge kind of cultural issue on campus. And so in both those times, I had kind of been like, okay, let me get together with, you know, let me go to the Women's Center, let me get together with broad recognition, let's figure out what we're going to do. You know, are we going to make a zine? Are we going to, you know, help people who are organizing protests? It felt like I had a community. And I think just, even though obviously I was back in New York City, that's where my family is, and that's where I grew up, I just felt very not tapped into what was going on. And, you know, I was going to marches and that sort of thing, but it was hard. I just didn't feel like I necessarily had that community. At the same time, I think I was also just like grappling with what it means to do a 9-to-5 job where you're kind of exercising mainly one skill set. And I was missing just the creativity and the ownership that I had been able to exercise more in, you know, my leadership on campus the year before. And so I ended up quitting my full-time job probably like 7 or 8 months after Trump was inaugurated. And that was not the reason, but I do think that it had a little bit to do with it. I also, while I was working that full-time job, I was dealing with some mental issues, and I really started to lean into like wellness culture in a way that I had not ever before. I've always been athletic. I've always liked team sports. In high school, I, you know, started going to the gym. There was like a nice gym at my high school that I started going to at one point, and really was like, wow, this is an amazing way to spend time. So I've always kind of found it some level of empowerment through like fitness and that. So starting for the first time to lean into that culture more. And in doing so, I was getting some of the benefits of, you know, daily meditation and that sort of thing. But I was also realizing just how toxic that culture could be. And just seeing the ways that sort of, you know, wellness washed and really this like corporate aspect of wellness culture was being emphasized. And so I remember a lot of times, you know, talking to friends about classes I was taking, and, you know, a lot of my friends being like, I would never feel comfortable even stepping foot in that studio, and just being very aware of the privilege I had as this cisgender passing, like white, thin young person to walk into these spaces. And yeah, it might be uncomfortable for me because they might not fully understand who I am, and there might be triggering diet language and that sort of thing, but it being very different from the experience of, let's say, you know, a plus size friend who was showing up to a spin class despite having taken hundreds of spin classes before and being tutored how to use the bike every single time just because of the way she looked, right? So just started to feel both like I wanted to kind of do something of my own, build that community, start to tap into some sort of feminist queer community in New York City a little bit more, but also feeling like there's a real problem with a wellness industry that is really only serving people who maybe need it the least, right? And is also pulling from these traditions that are really rooted in, you know, BIPOC communities, in LGBTQ communities, in feminist communities, even just like the concept of self-care, right? And the sort of capitalizing on that concept. Sorry, it's storming here. It might. But so wanting to sort of like interrogate that and really just wanting to create like safe spaces, as we called them at the time, for people like, those friends who didn't feel comfortable coming to these classes. And for me, honestly, to explore some of these ideas and explore them in an explicitly political context. So I think the first event that I ever ran with Body Politic was in like April of 2018. And it was a conversation on self-defense and physical empowerment in the age of Trump. So it was like very political, and we heard from, mixed martial artists, boxing instructors, people who were doing self-defense instructors on sort of how they were thinking about this concept of like feeling safe in your body as tied to also, learning how to fight back physically, learning how to defend yourself, or even just feeling strong. And so I think the Body Politic has obviously evolved a lot since that first event, but that was really the goal kind of going into it, was to both give people a space, find a community myself, exercise some of this creativity that I had felt like I didn't have an outlet for, but then also to feel like, we were able to really interrogate and get deeply into these questions of like health at every size and, sexuality, the connection between sexuality and sensuality and movement, all of this stuff that I felt like was on the edges of what was being discussed in the mainstream wellness industry, but was usually stigmatized for like yoga class, and Trump has just been elected, but like no one is acknowledging that. You know what I mean? So it was kind of in that vein a little bit, I think.
So interesting. In some ways, it seems so inherently intersectional to sort of bring things together in simultaneity that could otherwise be argued or disparate, but, are making a case for them being, intensely relevant. Was that something that was explicitly in your mind?
Yeah, I mean, we talked a lot about like in the framing of these events and the content we were creating, we did talk a lot about just like the idea of the personal being political, but also the idea that means something different for each person. And that even as something as small as arriving at a meditation class, we're all arriving at that class with a different set of identities, personal experiences, emotional baggage, and just basically that needs to be acknowledged in some sense. And so I think, a lot of it was about kind of trying to create some intersectionality within this kind, I wouldn't, it was with wellness industry at that point in time in 2018, there are like a lot of amazing offerings doing exactly this, trying to kind of look at wellness through a political lens or create community wellness groups around a very specific identity. There are hike clubs for Black and Latinx folks in Los Angeles. There are, boxing studios for trans folks. That stuff was really only just getting started at the time. And so I think, a lot of what we were trying to do is just like identify those offerings and kind of make them visible. And so that was a lot of it as well.
And when you had that first meeting in April of 2018, was it already called Body Politic, or did that name?
Yeah, that was kind of I had, so the first thing I did was, I think in March of 2018, I had a brunch at my house, and I invited just a lot of friends that I had had these conversations with before. So the people that, would be texting me going like, I hate that I love this thing that I bought from Goop, like that sort of conversation. Or the people were like, I want to go to that spin class, but I just don't feel comfortable. Or that sort of thing. So I invited a lot of those people to my house, and I kind of threw this name around, like, what do you think of this name, Body Politic? Like, what do you think of when you hear that? Cool. And people were saying, that they thought of a group, that they thought of like a political entity with power, but also that it reminded them of kind of the ways in which their bodies were inherently political and both by their choice, but also politicized by society, whether that's because you're living in a Black body or a plus sized or fat body or a disabled body, or, a body with a uterus or something like that. So I think that was a lot of kind of, it was a name that was percolating in my head. And then I sort of like tested it out on
have your own focus group.
And a lot of my friends brought friends to that brunch too, which was fun. So it was kind of already expanding a little bit at that point.
And were those friends then part of the early beginnings of the group? Have they stayed with it, or have some folks moved on?
Yeah, so I think a lot of them were part of the early beginnings, because also at the beginning, like I was just basically invested like honestly a few $100s on having a first event and just like, you know, paying for the space, and then was charging for donation-based tickets. So, you know, anyone could come, just pay what you can. And I would just put a call out. I would send out an email like, does anyone want to volunteer to help me staff this event? Like, will anyone help me make name tags? I need someone to, you know, help pour the wine or whatever it was. And a lot of these people were really excited about doing that because, like me, a lot of them were working kind of like 9-to-5 jobs, entry-level jobs that weren't that exciting. And, you know, doing something like that on a weekend was fun. So a lot of them are still involved. I'm trying to think how many are still involved in some capacity. I mean, Body Politic has changed a lot since then. I think, you know, one of the people who has really been a part of it from the beginning is my friend Sabrina, who is also the person who infected me with COVID and co-founded the support group with me. And so, you know, we're kind of just like partners in creative stuff in general. And so she's always been a sounding board for me. And even now that she's a little less involved in the day-to-day activities of Body Politic, we still, as am I, because I've stepped back from kind of leading the group for several reasons. But she remains like a very active kind of partner in thinking through that stuff. But the most amazing thing that happened with Body Politic during the pandemic was just meeting so many new people through it, and basically identifying like the new leaders of Body Politic, all people that I met online. Most of them I have never even met in person. So yeah.
Wild. Maybe that would be a good segue to talk about sort of that watershed moment, how Body Politic transitioned into a space for COVID-19 and supporting those with long COVID.
Yeah. So, so I'll rewind to kind of like March 1st, 2020. Yeah. Wow, what a time. So we started hearing about, you know, the coronavirus, obviously. And I think at the point that it hit Italy, and was really devastating Italy kind of at the end of February, it started to become clear that probably COVID was going to come to the United States in some form. I started to talk to Sabrina and other people at Body Politic about what we should be doing, because it was clear that, you know, we weren't going to be throwing a huge live event like we usually did. And so we were talking about the idea of maybe creating some like Zoom support groups for people. Actually, we were like, maybe we should create groups for the two groups we were talking about creating was like an Asian affinity group for people experiencing harassment and violence. And the other group that we were talking about creating was a group for immune compromised people, cancer survivors, folks that might be at greater risk of COVID, because at this time, we were still very much being told that if you were young and, you know, generally healthy or otherwise healthy, you really didn't have to worry about COVID. It would be maybe a mild cold. And, you know, so I was thinking that my main role would be as an ally to the elderly and the compromised and that sort of thing. And then we had this meeting on March 10th. So Sabrina came over to my apartment on March 10th. And we basically met to just discuss the future of Body Politic. And we were talking about the pandemic a little, but we were also like talking about crowdfunding campaigns we wanted to get going. We were filming with all of these people involved in Body Politic in different states to talk to them about kind of what do you think we should do in this next year. And of course, COVID was like this backdrop to everything we were talking about. And so there was this little bit of what if, but really no one thought at that time. I mean, the first case of community spread in New York was only confirmed like, you know, a few days before that. So while we were in my apartment, Sabrina got an email from her that they would be like shutting everything down and that she didn't have to come back to work the next day. And then a few hours later, and this was after we had sat next to each other on a couch, like talking for hours at screens and also cooked and eaten dinner together, Sabrina got really pale. And she suddenly was like, I don't feel well. Like, I feel really weird. And, you know, of course, both of us thought, we were like, okay, just in case, she was supposed to sleep over at my house that night. We were like, just in case, just go home right now and, you know, rest up. And I guess we'll touch base later. You know, of course there was that thought, could it be COVID? But it really wasn't on anyone's radar to that extent. So she went home, and then 3 days later, I developed a headache and low fever, basically. And so that was March 13th that I became symptomatic. In the week that followed, we both got significantly worse, and we both were very, very, very sick. And it was not something that I was seeing reflected in any of kind of the mainstream news coverage of the pandemic. The difference in our symptoms was not necessarily severity. And I kind of drive this point home because I think that there have been some weird categorizations of mild versus moderate versus severe. The difference was that I had more severe shortness of breath than she did. So she was still dealing with like a wide array of very intense symptoms that were super debilitating. But because I had that severe shortness of breath, and also because I had a primary care physician in the city who I had, you know, known for years, I was able to get through to her and actually talk to my PCP and tell her what was going on. And she said that I needed to go to the emergency room if my shortness of breath continued to get worse. Sabrina, meanwhile, and I think this story just really conveys kind of how differently it can go for different people, was trying to get through to doctors via telehealth appointments, not having success. Sabrina's family lives in other countries. She did not have like a trusted doctor here. And she basically had to manage all of her symptoms on her own from home. Meanwhile, on March 16th, I believe, 16th or 17th, I spent one night in the ER. I was dying. The hospital was not a good place to be at that point in time, but it got much worse. So I ultimately did get lucky. I also got really lucky that I was hospitalized because so many people were turned away from the hospital at that time. And, you know, I've since read stories of Black women my age who were told it's anxiety and died of this virus at the same time. So I think my privilege as a white person, I wore my Yale sweatshirt to the ER because I was like, honestly, anything I can do to like wave a flag of like, I'm an important person. I know how the ER works. I know that like, here I am. At the time I was on, you know, a New York State health insurance plan that was like a step above Medicaid. I was a gig economy worker. Like I didn't have family members that were doctors or on the boards of hospitals. But I got really lucky. And so I managed to survive on supplemental oxygen. They didn't have to put me on a ventilator. When I got home, they discharged me after like 2 days in the hospital. They were like a little unsure whether or not to discharge me, but I wanted to go home. And one of the nurses said to me, this is not the place to be. When I got home, I thought that, you know, I would be tired and that, you know, it might take me a little while to recover. But what I never imagined was I did not think there would be new symptoms that would show up. Especially because at the time, the CDC symptom list was basically, you know, respiratory issues, fever, and maybe headache. There was nothing on there about GI issues, or any of the many other things that I began to develop. So the one piece of, there was no information, you know, you'd Google COVID gastrointestinal issues and you get like one story in some weird publication about someone on a cruise ship who had an upset stomach. Like it was very hard to find information. And so Sabrina and I really started kind of staying in very close contact at that point, texting each other about all of our new symptoms. As soon as I was able to speak again, because my shortness of breath made it very difficult to speak for, you know, about 4 or 5 days, we had a FaceTime conversation, and it was like looking in a mirror. Like we both felt freaked out that we were both dealing with these things, but it was the most validating. I mean, she was getting gaslit by like people in her life. I was, you know, emailing my doctor every day, could this be a thing? I have no idea. I had been told at the ER that GI symptoms might be food poisoning because you can't have that with COVID. So, you know, we were just talking to each other. Did you lose your sense of smell? Yes, I lost my sense of smell. Are you able to keep food down? No, me neither. You know, I'm getting hives and rashes. Me too. And you know, we were sleuthing. She was sending me a Twitter thread by somebody else who had lost their sense of smell. It was just this moment of like, okay, the CDC is unfortunately not going to have the answer to this right now. And my doctor might not even have the answer to this right now. But by talking to other people in the same situation, I might actually be able to find information. So happened in this time period that really helped in terms of information gathering was that I wrote an op-ed like 2 days after I was discharged from the hospital. I wrote an op-ed in the New York Times just about being young and being hospitalized because
coming out.
Okay, yeah. So I had posted on my Instagram that I had tested positive, like right after I tested positive. It seemed like one of the easiest ways to like get the word out to everyone that I had potentially been in contact with, and also just update people because you're exhausted. It's hard to text everyone individually. Obviously, I was still, you know, texting close contacts individually, but the reaction to that post really surprised me because people had so many questions. And I realized, oh, I have actually in a little bit of a glimpse into this thing that everyone is worried about and nobody knows about, which is what happens if you get a case of COVID that's so bad that you have to be hospitalized. So I felt like, okay, let me write something to kind of tell people more about this and also sound the age might not be as protected as we think. And that piece, you know, went viral. Weird choice of word there, but and so I started getting DMs from tons and tons of other COVID patients all over the world, saying like, I'm in the same situation. There were people I remember there were people in France, London, Germany. I was talking to people in California. There were a lot of people in New York that I was talking to. There was someone in Chicago that was DMing me. And in the days after being discharged from the hospital, it was actually very nice to have all of these people that kind of were going through something so similar. But it was also very difficult to communicate with each of them one-on-one because of this massive amount of responsibility to each of them. And I was exhausted and dealing with symptoms. And so I was talking to Sabrina about this, you know, when we were FaceTiming. And we were like, what if we just put them all in a group chat together and like started this as a support group? And you know what? Body Politic is kind of the perfect platform to promote this on. And I bet it'll be a helpful resource. So that was, you know, maybe like March 20th that we put them all in the chat together. It
happened so fast.
It happened so fast. Yeah. Yeah. And that like first chat, I still keep in touch with a lot of those people. A lot of them have made full recoveries. Some of them still have taste and smell issues, but a lot of them have made full recoveries. But like, I think we're very bonded as kind of, you know, we call ourselves first waivers, those of us who got sick in February, March, April, and obviously some people got sick in January as well. And so it was really meaningful to kind of be there with all of them and talking with them. But then I started to notice that they were not getting better. And a lot of them had a more mild initial case than I had. So there was, you know, a guy in the group who said, I have only had a fever of 100 degrees, but I've had that 100-degree fever for 3 weeks, every single day for 3 weeks. And he was like, I can't get any care because if I go to acute care or I call a doctor, they say, well, what are your symptoms? And I say, well, I have this fever. They're like, oh, it's only 100 degrees. It's nothing to worry about, you know? And so I started to feel like this is also at the same time, I'm like, my symptoms are morphing. In this bizarre way that I'd never experienced before, where now I have a stuffy nose and a sore throat and a sinus pain, which I didn't have. Suddenly I'm feeling light and sound sensitivity. I'm like getting these super intense headaches that I think are migraines. So I was like, there is something more here that we are not really talking about, which is what happens after that initial, you know, week of having COVID. And at this point, the World Health Organization was still saying it should like only take 2 to 4 weeks to recover from COVID. So I wrote this second op-ed, really thankful to my New York Times editor, who's amazing, who actually works on the gender section of the opinion section, for publishing this second op-ed about what COVID recoveries look like. I don't think she realized at the time what a big impact it would have. I didn't either. I remember even telling my parents I was writing and they were like, oh, that sounds kind of interesting. And in the piece, I linked to the support group, you know, sign up form, because at that point, as of March 26th, we'd kind of shared that we had this support group going. It was an Instagram chat. We'd like shared it on our Body Politic Instagram. A few more people had signed up. We had maybe like 30 people in the group at that point. And I interviewed a bunch of the people in that group for this article. So the article came out on April 13th, exactly a month after I got sick. And within like 24 hours of that article going up, over 2,000 people had signed up for this.
Oh my gosh. Wow.
Yeah. Yeah. And so I was like looking at the Google form. It was just every second there was somebody new signing up, and it was all over the world.
Wow.
Again, it was a lot of these hotspots, like a lot of people signing up from London and New York City. And it was just this like really weird feeling of, you know, I felt at the same time like incredibly stressed. Like, what the hell am I going to do with all of these people? They can't all fit in an Instagram chat. Like, I don't even know what I'm doing. And I also felt so worried and concerned that there were this many people dealing with these long-term symptoms. But it was also very validating, because when I wrote that article, I was like, this seems to be a problem, but I'm not really sure. And is it just, you know, am I making it up? Is it just a problem with me? Am I not pushing myself hard enough to recover? And so that really confirmed that, no, this is a widespread issue and something that needs to be talked about more. And that article was really kind of the first piece in a major mainstream news publication that talked about what we now call long COVID, people dealing with these long-term symptoms, and people specifically who had not been on ventilators, because of course, you know, we include people with kind of post-ICU syndrome within the long COVID umbrella. But I think that, you know, a lot of the long COVID stories we hear today are about people who had a more mild or moderate case and have kind of these multi-systemic issues afterwards. So I think that, you know, I'd love to say that that blew the lid off long COVID and then everyone started talking about it. Not quite. It took a while longer after that. I had to write many more articles. Ed Young, I think, was really helpful in getting it on the map. You know, he wrote about it in the spring. But yeah, so from there we moved to WhatsApp because we exceeded Instagram's chat limitation. And we were on WhatsApp for about, I don't know, maybe 6 hours. We exceeded WhatsApp's, sorry, I think I just cut out, but we were on WhatsApp for like maybe like 6 to 10 hours before we exceeded WhatsApp's chat limitation. And in the WhatsApp, people were also like, I can't follow this conversation, because people were writing every second.
I see.
So that was kind of where we got the idea for Slack, because we knew we could have these different channels and there was no, you know, member cap. And I had never really used it before because I wasn't working like corporate jobs. So I had to like learn how to use Slack overnight, but a lot of other people did too. And that's where we've been ever since. And I think we've had like close to 35,000 people sign up for this group over the whole pandemic. That's not the number that is currently in the group. There's 11,000 people, over 11,000 people in the group. Yeah, because some of the people who sign up, you sign up through a Google form and then you get a link. So some people don't, you know, choose to join. And then in some cases also, we keep the group just for patients and caregivers. So we've had like, you know, journalists sign up. We don't invite them into the group, that sort of thing. You have to kind of explain why you want to join. So, but yeah, so that's kind of a basic summary of just the support group. And then that support group ended up becoming really like a hub for long COVID advocacy. All of these other projects, you know, grew from it. The Patient-Led Research Collaborative is, I think, one of the most like widely recognized, which is patients conducting research on long COVID. They are also all scientists and people with backgrounds in science and research, which is something that sometimes gets ignored, but they also have an intimate knowledge of long COVID. And also they define kind of that expertise quite broadly. So you don't have to have, you know, super high level degrees. And there's a lot of kind of peer teaching that goes on there, which is very cool. And then obviously there's been a lot of kind of direct policy, you know, attempts at advocacy with policymakers and health agencies. And we're, you know, meeting regularly with the CDC and the World Health Organization and the NIH and the POTUS COVID Equity Task Force. And so I think it's really a combination of like that sort of thing happening. There have been letter writing campaigns, you know, meetings with the World Health Organization. There's a UK-based group called Long COVID SOS, which grew out of Body Politic and has a WhatsApp and focuses on the United Kingdom. And Europe as well. So yeah, that's kind of a broad overview of, I think,
super helpful. the mapping was really illuminating. And I'm curious, are you part of all of these branches that have grown off of that? I'm trying to imagine how you manage that time, and if that is part of, you mentioned earlier that you've, stepped away in some form, and if that is part of managing.
Yes. So until I would say like June of 2021, I was pretty involved in most of these things. My involvement in the patient-led research collaborative was generally just as a editor. I do not have the background as a researcher to be like, doing data analysis or that sort of thing. But I often, help them look over their surveys and just make sure that like the language was inclusive for our communities, and sometimes help them, edit some of their reports and stuff. But less involved in that. Although I'm close with all of the people who run that initiative, and they're doing amazing work. I was pretty involved in a lot of the advocacy work. I attended a lot of those meetings with the CDC and the NIH and the World Health Organization. And I would say, again, kind of up until June. And then a lot of my focus as well was just on communications. Like I was kind of, on and off directing the social media for, the past year during the pandemic with, a lot of help from other amazing people. And also just managing like the media relationships, because we were getting so many press requests, and it's a very kind of touchy and difficult thing to navigate, how to connect a group of vulnerable patients with journalists who do not understand exactly the dynamics that are going on. So kind of trying to figure out ways to streamline that system, make it better, make it feel safer for patients. And then I've also done a lot of work just educating the media about covering long COVID. So I've written guides to interviewing COVID patients. I've written guides to writing about long COVID and related illnesses. I've done a couple of like, workshops. We had a media training workshop in our support group, actually, at one point. GLAAD. I had a friend that Sabrina's girlfriend worked at GLAAD, and she basically organizing and did training for people in our workshop who wanted to do advocacy work. But I stepped back from a lot of this in kind of June and July for a combination of reasons. The first was just that I'm not the same person I was before I got COVID, and I still have some lingering health issues that I have to manage. But I am not, my life is not severely altered by my long COVID experience anymore. I don't experience like daily debilitating symptoms, and I haven't really since I got the vaccine. My first 3 months were quite difficult, when I first got sick. And then after that, I was intermittently ill. I actually had a lot of menstrual issues related to COVID. The vaccine offered quite a bit of relief from some of those symptoms, and it has had therapeutic qualities for some people. So I just felt like, the president is kind of the spokesperson of the organization. And I felt like the face of the organization and the face of this patient-led long COVID movement ideally should not be, a white non-disabled person. And so the person who is running Body Politic now is someone who I connected with, very early on in being sick. She was a member of the support group. Her background is in activism and advocacy. And she's a Latinx organizer living in Los Angeles who has, I think, dealt with more of kind of the long-term symptoms than I have. And so I just wanted to position myself a little bit less in that spokesperson role after kind of, mostly recovering. But also, to be honest, there were financial issues for me. I am, I hadn't really prioritized my financial situation for most of the pandemic, because I was just so grateful to have a little bit of savings that I could live off of while I was, at my sickest. And running Body Politic was incredibly fulfilling, but it was not something I was personally making money off of. The donations that we got kind of went straight back into, managing the subscriptions for different things and compensating, the few members of our team who were doing more project management and that sort of thing. So it got to a point where I also had to take a good hard look at my life and realize that I was putting myself and members of my family perhaps not in the best situation by not prioritizing my own finances a little bit more. So I'd say it was a combination of both those things. So I'm still on Body Politics board, and I still volunteer hours with them on a weekly basis when I can. But I would say less in the kind of leadership role of the organization right now.
That makes a lot of sense. And I'm really glad to hear that you're feeling better, if not fully recovered, and that it is not impacting your life on a day-to-day basis, although maybe it is in some ways. And I'm sorry that you've had to navigate all of that.
Thank you.
I'm curious about sort of the intersectional dimensions of your experience with Body Politic and with long COVID, maybe more generally. If we could tease out sort of the gender dimensions, the race, the class dimensions that may or may not have emerged immediately or over time.
Yeah, definitely. So I think, I think that personally, the most kind of significant political evolution that happened for me during the pandemic was just fully coming. I had always been aware of the disability justice movement, and I had, had some level of education in that, but I honestly don't think I really understood it until I myself got sick and witnessed, this mass disabling event. And so I think the framework of disability justice has been really important throughout this pandemic for me, just in terms of recognizing, both the fact that what's happening with long COVID is not new, that there have been people that have been largely neglected by medicine and science who have experienced, post-viral and post-infectious illnesses that have, that we don't have a lot of answers on, not because they are inherently mysterious, but because the funded research hasn't necessarily existed. And also understanding that a big part of why that may be is who these illnesses affect. So I think a real mentor, there have been a lot of mentors for me throughout this past year, many, many people from the ME/CFS community, people with myalgic encephalomyelitis, has been a really influential person kind of in my own political journey. And I think her documentary Unrest paints a very clear picture of how, the connection between kind of gender and medical sexism and medical ignorance about these illnesses. Similarly, I have connected with a lot of folks who were involved in ACT UP. And it's been really helpful kind of learning more, this was something I studied in school, and obviously I was born in the 90s in New York City. So AIDS was certainly a backdrop for, much of my childhood and kind of upbringing. But just to learn more about the different organizing techniques, and as well to think more, I think that both, ME/CFS and the activism that's happened there and the HIV/AIDS activism, there are so many lessons to learn from that. And especially with, HIV/AIDS, there are some clear kind of pitfalls to avoid. And, I know that my own personal story got a lot of attention. And I know that it was kind of helpful to use my face and my story as a way to get eyes on this issue. But I'm also feel weird about it because I know that got attention because I was a Yale graduate and because I had a quote unquote fit and active and healthy. And so I've been very concerned kind of from the beginning about the erasure of people with, who were disabled prior to getting COVID or who were chronically ill prior to getting COVID. There's been a real kind of, so often when there's a story about someone dying of COVID or developing long COVID, the first question from commenters is, well, did they have a pre-existing condition? And so just which is such a ridiculous question when we live in a country where the majority of people have pre-existing conditions. So I think, thinking about that, thinking about, well, what would this story have been like if I wasn't white? I have friends that I've met through the long COVID community that got sick at the same time that I did, that did not get the same care that I got. I have a close friend now who is a Black 39-year-old woman in Baltimore who had more life experiences than I did, more experiences kind of navigating these systems, but was not treated with the same respect that I was. Similar thing with Angela Vasquez in Los Angeles, who's running Body Politic. And I think we saw that with HIV/AIDS too, right? We had kind of these white men, white male leaders. Okay,
there we go.
I think we're back.
Yeah.
Okay.
There was a moment where I thought I might lose you, but you're back.
Yeah. So just looking at HIV/AIDS as well, kind of thinking about how, a lot of the movement initially was defined by these public faces like Peter Staley and, Larry Kramer and these white educated men who, were really effective at getting eyes on the issue by sort of, in the case of Peter Staley, like, this would be your son, this is a handsome white guy that you wouldn't necessarily know is gay, and he has this illness and you could have it too. But I, in writing about kind of how to cover long COVID and COVID, I have interviewed journalists that have covered the HIV/AIDS epidemic. And some of the things that have, come to mind or that have come to light are, it feels like there's such parallels with what's going on right now. So specifically, media coverage of AIDS in the United States really peaked and then started to decline. But at the point that it was declining and kind of focusing on the rest of the world, that was the point that cases among Black Americans surpassed cases among white Americans in the US, right? So there was this huge focus on, AIDS in Africa and the global AIDS crisis starting in kind of the late 90s, early 2000s, when we still had and continue to have an AIDS crisis right here in America, but we're not putting our aid there. We're not putting our, so I'm very concerned about kind of the same thing happening with long COVID, because I see this, again, kind of refusal to view it intersectionally, refusal to, even the policies that we're seeing, happen right now, this huge emphasis on vaccines, when I know a lot of long COVID patients that weren't able to get a second dose or even a first dose of the vaccine because, of the detrimental impact it had on their health, right? That's not to mention all of the economic barriers that exist to accessing, vaccines, and some of the cultural barriers in some communities that are preventing people from feeling safe going and getting vaccinated. So I'm sure we're going to kind of see this get, and it's happening already, get siloed off as a problem of the poor and the disabled and the elderly and the Black and brown. And, that white upper middle class people are going to be really encouraged to just forget about those people and continue living life and quote unquote getting back to normal. So I think that that's something, it's like, you can't address the pandemic without addressing racial justice. You can't talk about long COVID without talking about medical racism and medical sexism. And you can't talk about any of this without addressing like the broken healthcare system and how difficult it is right? It was difficult for me to access healthcare for this illness to some extent. And in many ways, I had a lot of the kind of privileges and safety nets that other people don't have. So when we're talking about undocumented folks and uninsured folks and people who, are coming from low income families, some of the people that I was talking to in that first group chat were living in multi-generational homes where, many people in the home were essential workers. And so I just have a real concern that there's been kind of a focus on science and public health policies as this, singular objective tool of science without really looking at how it intersects with these other larger, movements and struggles. And I think the other movement that I am kind of confused about talking about COVID within the context of is just the climate justice movement, because I've seen people say, oh, COVID is distracting from that. And I feel like this is the first, like, it's certainly not the first test, but this is one of the largest tests of kind of how we are going to grapple with climate change and this massive rush to return to normal and kind of, just the only people who need to sacrifice are the ones who have already sacrificed so much. That feels like a very clear parallel with what could go wrong with climate change, not to mention there is a direct correlation between increased disease and climate change. And I think that's something we're ignoring as well. So, I had hopes at the beginning of the pandemic that everyone would kind of change their approach to disability and become so much more intersectional in their approaches in general to COVID. I don't know that that's necessarily happening. I'm feeling a little depressed at this specific moment. I still have some level of hope. And one thing that gives me hope is there are med students in my, my age, I'm 28, I just turned 28. There are med students that I went to, high school or college with, who have been DMing me throughout the pandemic saying, thank you for teaching me about long COVID. Like, I really care about this. And I'm, excited. One of my best friends is in medical school right now. And they're, very educated on long COVID and send me articles about it and that sort of thing. And so there is this part of me that's like, maybe this next generation, if they can make it through this hellscape that seems to be med school, but maybe this next generation of, medical students who are a little bit more diverse, despite all the barriers. Not my friend is non-binary and has immigrant parents, right? And another person I'm talking to is like a feminist and who also has immigrant parents and watched, her own mother be mistreated in healthcare systems. So I kind of feel like maybe if there's a greater awareness on that end, some things will change. But I can't say I feel super optimistic right now on December 27th, 2021.
Mm-hmm. No, I think that's a great point. I'm curious if you had the opportunity to be in front of a med school lecture or residents, what you might say to them, sort of, here are some key takeaways that I'd like you to think about as you head into the field.
Yeah, that's a great question. And I have one of the groups that Body Politic has been meeting regularly with is I always get the acronym wrong. I think it's AAPMNR, the American Association of Physical Rehabilitationists and Medical Professionals, or something like that. So those are people further along in their career, obviously. But I think, the first thing I say to everyone in med school is like, watch Jen Brea's documentary. Mm-hmm. It's an amazing introduction to kind of, how post-viral and post-infectious illnesses have been neglected, what it's like to be a patient with one of those illnesses, and the gender and racial dynamics at play. And I know that they've also made some efforts to make that film available to medical schools and medical students. I think the other thing that has just become clear to me in the past year to 2 years to longer is sort of the ways that fat phobia and a capitalist focus on production really impact the medical advice that patients are given. So even if we look at like the changes right now that are going on with, okay, we're back.
Yay.
Sorry about that. But even if we look at like, the New York's governor just announced that essential workers only need to quarantine for 5 days after, and this is not medical advice, right? But it is being taken up by some of these health agencies after testing positive, even if they feel mild symptoms, right? I think throughout the pandemic has been this question of like, what is the appropriate guidance for people? Mm-hmm. And so much of it is kind of based on this desire to remain productive and keep, people productive as workers. And at the moment that they are not able to be productive in the workforce anymore, there's just a total abandonment. Mm-hmm. And so I think that does bleed into medical advice to some extent. I mean, something that we've seen throughout kind of the emergence of long COVID is a lot of doctors trying to treat long COVID with aggressive exercise therapy, mm-hmm. as well as cognitive behavioral therapy in some cases. And I think just kind of not every form of exercise therapy is inherently wrong or anything like that, but I think understanding a little bit more of those roots of, fat phobia and this emphasis on productivity, and actually digging a little bit deeper into the science of what is rest going to be more helpful for a patient, and does it perhaps not matter if that patient is 120 pounds or 250 pounds? Mm-hmm. I think some of that is going to be needed right now, mm-hmm. And I think that would be a really helpful place to start. And there's a lot of amazing, people in healthcare also who are looking very specifically at kind of the supposed correlation between, weight and obesity and, different health issues, and trying to kind of dig a little bit deeper into what is really going on there, and how do we separate kind of the science from what might be fat phobic cultural assumptions and that sort of thing.
I know you wrote a piece about resting your way to feeling better. And it seems like that's an important message to broadcast, and probably one that can be difficult to both embrace and probably make possible given people's range of restrictions.
Yeah, absolutely. And I think that's the other thing I hear from patients a lot is like, we want doctors who say, I don't know, when they don't know, right? And we also want doctors who who recognize the limitations of the advice that they're giving. So I had a thread. I mean, I am not a doctor and I try not to give medical advice, despite the many inquiries I get sometimes on Twitter, but I had a thread the other day on kind of some steps you can take if you test positive for COVID, or if you think you have COVID, to help you later on, should you develop long COVID. And, you know, one of the things I said was listen to your body and rest if you can. You know, if you feel sleepy, sleep. If you feel like lying on the couch, lie on the couch. But I had to put the caveat of like, I recognize that all of this advice is incredibly limited in a world where, you know, there are not the necessary workplace protections in place to take this time off. And, you know, people are taking care of kids. There are tons of limitations to getting enough sleep or in accessing testing for the virus, which is one of the other things I had suggested, was to try to get that positive test early on. Sometimes it can help with getting care, right? So I think that's another thing, right? Is I know that a lot of people don't like going to the doctor because it feels like a report card and you failed because you didn't jump through all of the ridiculous hoops that are not actually, you know, grounded in the reality of your life that the doctor suggested. So I think as well that, you know, some of the best clinicians that I've talked to really recognize and work with what a patient's individual situation is and really remove shame and blame from the conversation as much as possible.
It's interesting because, you know, the field work I did on Lyme disease is now already 10 years old, but one of the most common responses that came up when I spent time with chronic Lyme patients, when I would ask about what makes a good physician, was we just want a doctor that says, I don't know, and is okay with uncertainty. And so that striking parallel and convergence, I think, is really interesting. I think an interesting difference is the extent to which social media has become part of knowledge production in a way that was not available, you know, in 2010 and 2011. I think that's a really interesting contrast, how much that has made, you know, just going through the various rungs of your ladder from, you know, Twitter, Instagram, I can't remember what the progression was, Instagram, WhatsApp, and then Slack, you know, those are things that even just a few years ago wouldn't have had the same access. I think that's a really interesting contrast, and trying to map out spaces of legitimacy.
Yeah, definitely. And I mean, people with Lyme are another group that has been like very much neglected by the medical system, and I think that we're learning from as well. But yeah, you're absolutely right. I think it's a combination also of you know, it being a little later in time, and the pandemic also moving so many of us online, that even people who weren't there before, but also like, you know, I have had a cell phone since I was like 10 years old. You know, like my generation is just very tapped into this stuff. And so even, you know, it didn't feel super weird to me to be like organizing people via Twitter.
Right. Yeah. Such an asset in that way. So I thought maybe we might wrap up tying everything to feminism and contextualizing what you've said up until this point with your thoughts about feminism. So how you understand the term feminism, what it's meant to your work sort of over the course of your journey, and whether you yourself consider yourself a feminist.
Yeah, I definitely consider myself a feminist, but I think my understanding of feminism and what it means to me has changed a lot. I mean, as I mentioned, like I got a feminist education really, really young and quite early. And so I was like the 6th grader carrying the feministing tote bag and like having everyone, you know, I grew up in like the aughts and the Bush years, and it was not cool to be a feminist until I was like basically in college. And so I think there was, for a long time, it was just sort of a way of saying fuck you to all the shit that I didn't like about the world. And it felt like and I got a lot of shit for it also. But I think also that a lot of my earlier ideas about feminism were about like inclusion and representation. And I think a lot of that is also just because I was socialized as a white girl and had, you know, a relative amount of privilege in terms of like education and the sorts of opportunities that were provided to me. So there was a real emphasis on like, we need to get girls like you into positions of power, kind of that type of messaging. And then I think as I got older, and especially sort of the beginning of college through my college years, just learning more and learning about how perhaps, the systems themselves need to be rethought. And it's not just about, getting an equal amount of women senators or women congresspeople or, whatever it is, right? That if the system itself is not serving the most marginalized, then it really can't be called a feminist win. And so I think, reading more thinkers that, I had Audre Lorde books as a little kid, but I think getting to delve deeper into this idea of kind of, no one is free until we're all free, and understanding that also, I think a lot of changes happened in my own lifetime, right? Where certainly, there are still major just issues of, pay disparities and just basic issues between even, the most privileged kind of woman and the most privileged man, but understanding a little bit more that, I think for me, being a feminist is having that more intersectional approach and really focusing on like, who are the most marginalized populations here, the voices that aren't being heard. How can you amplify and center those voices? How can you not just continue to work within the same system, but try and actually reinvent the system or reshape it if it's not working for those who are most marginalized? And so I think that's been a major change for me as well. And then even just with my own identity, coming to terms with I'm genderqueer, and just sort of understanding more about my own gender identity throughout life. I think, that trans issues are a huge, huge part of the feminist struggle right now. And I think that is absolutely an example of, members of our community that are in many cases most marginalized. Rights for trans men and trans masculine people, or whether we're talking about sexual harassment and sexual violence and gender-based violence that's happening to trans women on a very high level right now. And it's been disheartening to see some people who have called themselves feminists in the past kind of pivoting away from those communities and trying to refocus the conversation only on cisgender women. And so I see that as being a really important fight right now as well. I think it's kind of that transition from just absorbing a little bit more of what was lean in type feminism and, she should run type feminism, and just moving a little bit beyond that, especially after I worked for a woman Congress person, I campaigned for Hillary when I was in middle school, but the world did not change overnight because of those things. And I also saw a lot of the limitations that those people were facing just because of kind of the way that they had chosen to try and affect change. And also partially because, of who they were and some of the perhaps bubbles that they existed in. So yeah, that's a big question, but I hope that
you answered it beautifully. And I was thinking, I was just reading this morning your most recent piece on beauty pageants, and I'm curious about how some of those thoughts are informing your most recent work as of just I think it came out just a couple of weeks ago, right?
Yeah. I mean, that was really interesting because I participated in that system in 2015 or something, so not that long ago. But there's a totally different approach, amongst the people that are participating right now. And I actually felt really heartened by the conversations that I had with a lot of the people that are participating in that system right now, just even to see how much has changed in terms of, obviously, it's still not easy to be trans or non-binary. And in many spaces, it's not even easy to be, gay or lesbian or queer or pansexual, but just to see some of this greater level of comfort with expressing themselves authentically, that they are even down to do it in one of the most traditional beauty pageants. And so when I first started researching and writing about Miss America, the question for me was always does it matter? And why does it matter today? And that sort of thing. And I think this piece I approached with this different mindset of kind of how is it serving these people, and how does it provide kind of an outlet on not just what young queer and trans people are interested in and how they're expressing themselves, but how are these traditional institutions going to grapple with a new generation that is not just going to put themselves into the cardboard cutout of what a Miss America is supposed to look like, or even, or whatever it is, right? What a journalist is supposed to look like, or, you know, any of these different things, what an activist is supposed to look like, and really are saying, I'm not willing to compromise and sacrifice that part of myself. It was like inspiring to me on a personal level, just because I'm a people pleaser. I was like a high achiever. So I have to, even just in my personal life, kind of remind myself that like, I don't need to be the thing that makes people most comfortable. And I think like, that is a lot of what feminism is, right? Like taking that question of, you know, whether it's respectability politics or, you know, the comfort, like fitting yourself into what makes people most comfortable. When we say people most comfortable, we're generally talking about like a patriarchal white supremacist culture, right? A capitalist culture. So we're talking about what's going to make the leaders of that culture most comfortable. And if we want to change that culture, then we probably, you know, focus on that, which is easy to say. The reality is that it can be dangerous to do that right now. But yeah, I'm definitely interested in that. And I think just going forward, you know, I'm really hoping in my work to continue exploring kind of the connections between all of these different things. You know, that was also a pandemic story, because it was a story of things that really changed during the pandemic, when everything was thrown up in the air and people had a chance to actually question what really matters. And so I think I'm really interested at just continuing to look at those intersections between kind of how the world is changing, both with regards to the larger culture and kind of pop culture and media, but also how that relates to, you know, mass disabling events triggered by, you know, some of these, you know, climate change and that sort of thing, and kind of the expansion of even just, I keep thinking a lot about how the number of disabled people in this country has hugely expanded in the past, you know, year and a half, and will continue to, and what that's going to mean. And feels like something's got to give, but we'll see.
Well, I'm so glad that you're thinking about those things, and I really look forward to seeing where your work goes, and look forward to reading it. And I guess before I end, I just want to make sure there's nothing that you wanted to say that I didn't ask, or anything else that you wanted to add to our conversation.
The only other thing I'd say is I think I'm always like, when I'm thinking about, you know, feminism and even just like social change and that sort of thing, and my place in these movements is, we talked about this a little bit, but like, I am always kind of struggling with, you know, how much to both that I know I can kind of have like a proven track record with making change, right? So for example, another reason I stepped back from Body Politic was I don't have a background in advocacy. Like, I have a background in solutions-based and advocacy-based journalism and community building, but I'm not super experienced in like interfacing with policymakers and trying to get them to change, you know, their policies. So I think that's something that I'm always kind of thinking about. And I think I'm also just very wary of kind of the saviorist narrative that can come into play in so many of these movements. And one thing that's been really illuminating, working with all of these different groups on kind of this patient-led long COVID movement, has been seeing that unfortunately in every movement, there also are those people who are going to kind of swoop in and say, you know, without the lived experience necessarily, or with, you know, way more kind of financial, economic, whatever privilege, and say, okay, I know the answer on this, and everyone needs to, you know, listen to me, and kind of drown out some of the smaller voices. So I think I'm just thinking a lot about, how do you have a successful movement that doesn't have just one spokesperson? And how do you also, you know, groom is a weird word, but how do you train and expand spokespeople for a movement without just buying into what the media wants, which might be racist and sexist, and playing into some of these, you know, ableism and respectability politics, right? How do you use the media to get your message across and do what you want, and you know, have an impact without allowing the media to kind of define what the movement is, if that makes sense.
Makes a lot of sense. And I think it's a good challenge that will take some time to work on, but I'm glad that you are. Well, this was such a pleasure, and
thank you.
I'm
likewise.
So grateful for your time and your willingness to share your story. It was really illuminating and inspiring. So thanks a lot.